Okay, good afternoon. It's 2 minutes past 12. I'm Jiajie Zhang, the Dean of the McWilliams School of Biomedical Informatics at UTHealth Houston. I'm the moderator for the last panel. So between this and lunch, so you're all here? Great. So let's use this final conversation to move from exploration to alignment, from aspiration to execution, and from excitement to the actual hard work. So on the panel, we have Klaus Jensen from UT Austin Dell Medical School, David Jeffrey from MD Anderson, Peter McCaffrey from UTMB, Jiajie Zhang from UTHealth Houston, and Yang Xie from UT Southwestern. Over the past day and a half, we have seen an extraordinary demonstration of talent, creativity, and commitment from across the entire UT system. Through keynotes, institutional showcases, breakout sessions, industry panels, and posters, one message is very clear. AI in healthcare is not just a trend, it's a transformation already in motion. We explored how AI is impacting every facet of mission, from research, education, to patient care, technology development, data infrastructure, governance, and partnership. We also saw the early fruits of AI projects at individual institutions. But what can we do together at a system level to do more? So first, before we start the panel question discussion, I want to share an experience that we had at UTHealth Houston. We are in the middle of strategic planning, institution-wide, with all the schools, all the clinic entities, everyone together, and also with external partners, to really want to find out exactly where we're going, because we have so many things going on. People start things here and there. There's no coordination, no communication, and everything come up, and a lot of duplication, lack of focus. So the purpose of this is to identify strategic vision for UTHealth Houston. I think this is something that we should do if we do at system level. But let me share you with something we have in the process. Number one, Texas is the eighth biggest economy in this country, right? Bigger than Russia and Canada, so amazing. And UT system produces 63% of the state medical degrees. And we have 7 health institutions and medical schools together. So for the UT Health Houston, we have AI task force across the entire institution. What we want to achieve is to basically articulate a compelling institutional vision for AI. We want to be all in on AI for everything. And first, we need to start a comprehensive, rigorous assessment of what we have, the capacity, the talent, and everything. Then to define strategic priorities to guide AI integration across every single domain, every part of our mission, and recommend targeted high-impact initiatives to the leadership so we can get resources to get things done, and establish a rigorous government structure to make sure have safe and reliable, responsible use of AI, and then to enable cross-institutional delivery of AI to make a big impact. So we have a big committee. I asked people to join, nobody turned down, and many people wanted to get in. Some people wanted to join more than one committee. We have more than 80 people. Unbelievable. Well, I got this started like 2-3 weeks ago. And so we have a committee. I'm the chair of the task force, and we have 7 subcommittees, and we have 3 staff members to help with the execution of the planning exercise. And I was recommended with a lawyer for steering committee to make sure we keep us out of jail and also keep AI in the jail, so it will not get out to harm people, right? Okay, so we have 7 committees for education research, patient care, technology, data platform, governance and partnership. And this is a very ambitious project with 6 months. We hope to deliver something at end. It's already mid of the first month. Number one, we want to do a strategic landscape assessment, and then strategy and policy architecture, then alignment and ecosystem engagement, and then final product to recommend to our the leadership across UTHealth Houston to actually do something in an organized way. All right, so that's what we're doing. So here, my question for the panel here is to discuss if we were to develop a system-wide strategic planning exercise for medical AI healthcare, what should we focus on for each of the 7 areas? Let me bring it back. Okay, we have research, education, patient care, or 7 areas. So what I would like to do is to ask one of the panelists to start on one question. Other people can always jump in because I don't have much time to start. Then I have the last question for the audience, all right? So hopefully we have enough time. So the first one is for research. I want Zhang from Southwestern to start the discussion. So if we were to do something with the approval of Dr. Rojas, strategic planning across institutions, what are the most important things we should focus on for research in the context of AI that we can collectively do better?
Okay, sure. So thank you for the question. So first of all, I would really acknowledge that for now, I think UT system has really strong biomedical research and AI research already. For example, at UT Southwestern, we have 6 Nobel Prize winners, which is probably one of the most in the country in life science. And we also have more than 20 National Academy of Science members and ranked as #1 by Nature Life Science Impact. Similarly, in many other UT schools also have really strong biomedical research already. And in terms of AI research, as I mentioned yesterday, AI research in precision health, in medical image analysis, and also how to really improve patient care using AI. I think all of those I think we're really proud that we're already doing really well. But now the question is, with the really very fast-growing AI technology and method, what should we do now to adapt, to leverage the AI technology to make the scientific discovery even faster and better? So to achieve that goal, I do think we should really leverage the UT system. I would say a few things. I would really hope that UT system can help as a researcher to really to leverage AI. The first, I would say, the infrastructure. So if we already have Texas Advanced Computing Center, which is a big advantage for Texas researchers. But if we can really build a very strong computational infrastructure for all the data storage, GPU computation, together with some of the latest tools like Meta just mentioned, there are so many really good kind of AI research tools. If those can be installed really very early on, and then also educate researchers, especially some researchers who are really good at biomedical research, but who they do not really know too much about the technology. If those tools can be installed and be educated, they can use the tool for their biomedical discovery. So that is the first thing I would say, be very helpful to build the infrastructure for the computation and the tool installation. I think the second I hope is, I think this UT AI symposium is really helpful. And maybe we can also consider to have some smaller symposium for researchers. So I think people from different schools be able to really get together to talk about their own research and to brainstorm. I think that itself can be really helpful for really how to work together. So that is really to bring people together. And the third would be, I think, I talked to Xiaotian yesterday, is about the IP. right? So for example, if we really want to work together across schools, what will be the best IP, kind of how to share the IP? I think right now it's more like at the individual level, but if we can have more like the system level of how to solve this problem, how to make this move much faster, I think that can also encourage collaboration across different schools. And fourth, I would say maybe the education, because we have a lot of really talented students from like, for example, in terms of like computer science at UT Austin, and also like medical students from other health systems. So really, how can we have more like a strategic plan to foster this education? So the technology kind of CIS math student, they can learn more about what is the problem in life science, and the life science student can learn more about the technology in AI. So I would think those are four things I think probably at the system level can really help research.
Okay, great. Thank you, Yang. So, Jiajie, since she mentioned your name, do you want to add some comments?
Yeah, for sure. So I think in the last 1.5 days, we all learned a lot to digest. Each institution brings their own strengths and a unique methodological innovation. So from our perspective, I think we can contribute to, for example, the development of multi-modality models because the massive faculty expertise in our school. So we can help the system to develop a model that connects both imaging, omics, NLP structure. And then we also can help to contribute to federated learning models so that we don't have to ship the data across sites, but we can push the model to local so that we can have a common benchmark. Say if a model built in UTHealth, does it work in UTMB or does it work in Southwestern, right? So within the system, we can check, imagine like if we have a model zoo internally available across the UT system without worry about the privacy leakage of the model we trained, we can evaluate across against each other. That would be amazing on the research end.
Okay, great. So AI, about research here, we do not just mean research about AI. The more important thing is to how to use AI to transform basic, especially translational, the basic sciences. Okay, as you heard from the presentation here, and AI used to make drug discoveries and all that kind of things. So, all right, so let's go to the next topic, patient care. So Peter.
Yeah, so a couple of things. I think when it comes to patient care, what we should do as a system, which is often the challenge for executing on the strategic vision, is establish specific initiatives and outcomes that we all actually want to achieve together and go down that road together. I think one of the challenges to realizing a vision of an AI-enabled UT system is sometimes we say, well, we want to do this, but you want to do that, you want to do this, we want to do that. And we all have things we do that are individual to institutions, but some things we want to do are universal to institutions. So we should say, we're going to tackle this problem this year, or figure out how we're going to tackle this problem this year. It could be anything from navigation, anything from explaining results, anything from provider efficiency. Ambient is a great example of this. It's one thing to standardize on the tech, which you could argue that that's a way it could look if you said we're all going to use this tool for this solution. But perhaps more important than that, we're all gonna do something for this solution. We're gonna agree on kind of how we measure the outcome. We're gonna come together and talk about what that outcome was and push it forward. So I think it's that like concentrating on a specific thing. I go back to something like ambient because it's kind of already there in probably most if not all the institutions. So it's a readily available thing to consider just doing at a higher scale, maybe as a test bed for how it could look, to be transparent and to coordinate. Summarization, another adjacent task. It's low-hanging fruit maybe to try it out, but I think the big part is the difference between isolated trying out and an actual coordinated, like, what does it look to really bring this to reality at scale, and how does it work, and how do we iterate? It's the closing the loop on the iteration part, I think, is the actual unlock that will let us do things as a broader collective.
Do you have any comment on fully automated clinical AI systems in contrast with supervised?
Yes. This is my own hot take, okay, if I may say this, but if you look at the demand of what people want out of healthcare and how far it is from the reality of healthcare, where a world where everyone in Texas deserves access to medical inference anytime, anywhere, on anything, we definitely can't deliver this without some automation. I think in some forms that will be full automation. The sheer scale will probably demand that. There's a responsible path to getting there, but it is possible to make reliable systems that can be somewhat supervised and eventually maybe unsupervised. So I'm very open to that world existing. My personal belief is it's inevitable, frankly speaking, to making the healthcare at the scale people demand. And everything around it will come to find a way for that path to come to reality, or we'll just have to kind of agree on having a less scalable healthcare. I don't think we're all going to agree to have that. I think we're going to make it work somehow.
I think we already see some automated approach yesterday, right? Andrea Cooley's digital retinopathy done in remote rural area, right? We should just do more of these, right? Expand, augment AI, increase accessibility.
Great. Okay, next question is for class. For data platform, what can a system do together across all institutions to move us to the next level?
The simple answer is quite a lot. But let's start with the fact that what we've spent the last day and a half talking about is that the future is now. What's interesting about that is that as we're paving the path to the future of healthcare, we also have to pace it. It's not just about what we do, it's about how fast we can move. And that's actually where what we do together comes into the picture. There's no question we could go out and think about data each on our own. There's a lot of great talent across the UT system. There's a lot of talent in this room. There's even more around us. But asking the right questions in terms of what's the problem, what are the right questions to ask, and what's the right team to bring together is where we started yesterday morning. It's an appropriate place to end when you're thinking about a data platform. There's three things you have to put in place to have the right pace for leveraging data for meaningful impact. One is you need to have the right technology and tools. Right now, each institution is thinking through on their own, how do you drive that equation? There are technology teams in each of your institutions, they're asking the same questions. I think it's quite simple to bring the right people together and just share experiences. It'll be even better if we can share some of the accelerators we built, because many of the tools and technologies we're using are the same. If one institution built automation, maybe another institution can use it. Maybe in some cases we can even share and share alike. If you think about UTHealth, that's a good example where we're not just sharing ideas, we're actually sharing infrastructure to bring data together. The next thing we have to do is sharing data. That's sometimes uncomfortable. Right? But again, if we bring the right problems, we ask the right questions, we bring the right teams, we will know what is the data we need to share. There's absolutely more we can do in terms of doing that. Again, UTHealth is a good example. But starting to share what are the research, education, and care problems Reed's working on, what data would you like to have to learn more about will probably help us optimize across the system. And then the third thing is, how do you make data ready for insight? This whole notion of how do you make data ready to be unlocked for AI is an interesting problem. We made a lot of progress on the operational side. I talked a little bit about it yesterday morning in terms of interoperability, etc. We've spent less time thinking about what is the right shape, format, and interchange for data for research. We need to talk more about that. We need to push things like HIEs. Which ones do we believe are going to be helping the most across all of Texas? May even need to start having our own opinions as what is the extended standard that we use for when we share data. We can make progress on all three of those, pushing the pace on technology, pushing the pace on sharing data, and pushing the pace on what is the shape of the data in the first place so it's useful for AI. I think we can make a lot of progress.
Okay, good. Jiajie, technology.
Yeah, so I think a starting point is if we can categorize all the technology developed in each institution, then we can see what has been developed or what are available, right? Imagine we can put agent on top of our existing technology on our metadata. Then this agent probably can talk to each other and tell us what things can be scaled from one institution to another and find some quick win and which data need to be harmonized or converted in certain manner so that it can be shareable, interpretable, and lovely, maybe they can even write IRB for us and then eventually whole streamline the entire process. I think we can build infrastructure on top of what we have, but using AI to build what we need for AI.
Okay, David, before I get to you on the hardest one, on governance, I will cover education. So we have a big school, I mean the biggest one in the country on biomedical informatics, broadly defined. It includes medical AI, data science. We have over 500 graduate students, 2 doctoral degrees, 2 tracks of master degree, many dual degrees, including MD, MS, medical AI, whatever, PharmD, anything you can imagine. And we have 3 academic departments. We have over 60 courses altogether, including 30 dedicated to AI and data science. Everything's there, and almost every course is fully online. So we are willing to share our resources with any other institution. So if you, to build this, don't start. I warn you, because I got here 27 years ago. 27th year later, we have what we have now. It'll be faster if you ask AI to help you, but it's massive effort, okay? So one thing we can definitely share with all institutions is all the education content we already have. Everything fully online and optimized. So that's one thing we can definitely offer at a system level. So if we can find the right mechanism, so we get paid somehow, not totally free. we can do that. All right, so for governance and policy, David.
Thanks, Jiajie. Can everybody hear me okay? Great.
Yeah.
Yeah, so I think if I look at UT system opportunity, I think there's an immense number of steps we can take to learn together. So what we've heard today is that healthcare needs and our patients need massive scale of transformation. From the point at which we understand their needs, how do we support them in navigation, how do we learn from each one of them, and how do we change the way we work? We have a lot of momentum, there's a lot of silos and a lot of structure. The UT system can really accelerate a transformation that we all need to move forward through. And so the way to do that in my mind is to accelerate the pace of learning. In some ways, I don't know if we want to all align on the same platform or the same problem. There's so many things that we have to tackle, but if we share those experiences with each other, if we compare and coordinate, if we each, in our attempts to implement something, can say that worked or that didn't work, and build that innovation network across UT system, that would be incredibly powerful. And then if we can build the governance systems to make sure that AI is applied effectively and in a cost-effective fashion, it wouldn't be just serving our patients, it actually becomes a place where the world wants to come and bring their technologies. Why wouldn't a canary want to come here and work with us if they knew we could move these things forward, we could evaluate them, and we could demonstrate that value back out to the rest of the world? So in many ways, I think the broader surface we have where we're testing and learning, but bringing that back into a common team, I think is where the benefits of the system would be best realized. And I'm so excited about the dialogue we have here today, because I hear from each of us trying different things and bringing those back. That tells me someone else tried it. It didn't work. Why would I repeat that? And putting that in a common framework will really position us into the future. So I think this is where we really have an opportunity to start right away. We don't have to align on specific platforms and we just need to bring an innovation ecosystem that cuts across UT system to accelerate the inevitable future for our patients at large.
Great. So we have 3 more minutes. Okay, we have one more question on partnership, especially with all industries. instead of asking a specific person to answer the question, I want you to show hands. So in addition to just sell your product service to a UT system, if you are truly interested in collaboration for research, education, and development R&D, raise your hand if you are from industry. Great, we have quite a few. Okay, great. So UT System Collective, we have a lot of resources, and John can say yes to everything or whatever. Massive resources. I think we are really interested in a true partnership with a major corporation or organization. We can work together. I mean, especially with the current research funding situation, all the tech companies did most of the major breakthroughs in AI, and we're falling behind. So maybe you can work together with the data we have, the expertise we have with the domain. We can definitely do a lot more. All right. So to end this panel, so before we wrap up, I want to extend my heartfelt thanks to everyone who made the past day and a half such inspiring and energizing experience. To our speakers, panelists, organizers, students, attendees, thank you for showing up, not just with your brains, but with your heart. We came here to talk about artificial intelligence, but what I have seen is an extraordinary amount of human intelligence in this audience, and a surprising amount of caffeine-infused creativity. I think you're still awake. Great. So as we go forward, let's remember AI may be tireless, but we are the ones with purpose. AI may not sleep, but we definitely should, especially after a symposium like this. So before I leave the podium, I want you all to join me in thanking the true masterminds behind this incredible symposium, Sharon Green and Dr. Naima Shah. If you can. So they are the magicians, if you look at the experience for the day and a half. So I also want to give a shout out to the Tourney 20, amazing staff member from my school, whom I may or may not have gently mobilized, probably attracted them to come here to support this entire operation, help with logistics. Without them, the event would have had great ideas, but it would be total chaos. So again, stand up and show hands if you are from the McWilliams School. So now, please, our panel is over. So now let me invite the representative from the 3 organizing institutions, UTMB, MD Anderson, and UTHealth Houston, to the stage to make some final remarks. The 3 people are Jiajie Zhang, Peter, and Lima. Okay, all right, Peter's all yours.
Thank you.